Long before promising results like thalidomide, Judah Folkman was forced to make a difficult decision between surgery and research. He chose research, but his surgical background continued to prove invaluable, especially with a very dangerous aspect of cancer called metastases. But cancer cells do travel. A marble-sized tumor can release about 1 million cancer cells every day, and some of them survive very long journeys, from the breast to the lung, or the colon to the liver.
Cancer cells can enter the bloodstream, stay alive, and come out some other place, like the brain or the lung, and grow again.
Now what you have are hundreds or even thousands of tumors in the liver. And as each one of those tumors grows up, what happens is that the whole liver becomes replaced with cancer and can no longer function.
Sometimes the metastases will settle in a new location, but they don't call in new blood vessels and they don't grow. They're not dead, they're just dormant. When they'll wake up is not known, except in one unusual circumstance. Sometimes when the primary tumor is removed, the metastases suddenly come to life. New blood vessels appear, and the metastases grow rapidly. It only happens to a small percentage of patients, but it has troubled surgeons for more than a century. It was a medical mystery that would unravel in a most unusual way, and the answer would ultimately provide Dr. Folkman with one of the most important insights of his life. 2 years later, Dr. Folkman was at home reading with his wife when he came upon a paper that astounded him. It was from the lab of Noelle Bauch. She had discovered something remarkable. There are some normal cells that secrete angiogenic inhibitors all the time. Shown here in yellow, the inhibitors are part of the body's natural defense against disease. They keep our blood vessels quiet. But when normal cells switch to cancer cells, 2 things happen. First, they start producing blood vessel stimulators, the blue molecules. At the same time, they drastically reduce the inhibitor they were previously making. It is a delicate balance of chemicals in which the stimulator must overwhelm the inhibitor before blood vessels can emerge. But why would a tumor cell continue to make a blood vessel inhibitor at all? Dr. Folkman would think about that question every day for the next several months. Dr. Folkman finally understood that century-old mystery about metastases. When the primary tumor is in place, it makes a small amount of inhibitor, the yellow substance. It's not enough to overwhelm the much more abundant blue stimulator. But the inhibitor is very stable. It can survive the long journey through the bloodstream to the distant and much smaller metastases, preventing them from calling in new blood vessels. But when the primary tumor is removed, the source of the inhibitor is also taken away. Now the metastases are able to call in their own blood supply and grow. Suddenly, it was crystal clear to Dr. Folkman that the powerful blood vessel inhibitor he'd been seeking for decades could be found in the primary tumor itself. Now, all he had to do was inspire one of his students or colleagues to look for it.